How big a health problem is diabetes in the States?
Diabetes remains a serious health problem in the United States. According to the Center for Disease Control, in 2014, 29.1 million people had diagnosed or undiagnosed diabetes. The number is increasing every year, and diabetes is the 7th leading cause of death in the United States. So it is a significant health problem, a problem that really burdens patients and their families, but also has significant socioeconomic impact. So we are spending several $100 billion on treatments that are far from being perfect, that cannot really help patients develop devastating and deadly complications. So we need new and better therapies. We need new thinking. We need to be really innovative, and we need to be impactful to change the landscape of diabetes in the United States and around the world.
What is type 1 diabetes?
Type 1 diabetes is a disease that affects mostly children and young adults, and it is caused by an autoimmune disease when the immune system mistakenly destroys all insulin-producing cells located in the pancreas. To survive, patients must inject insulin every day and must follow a very regimented lifestyle and work very hard every day. And despite tremendous efforts, some 30% of patients will develop serious complications caused by diabetes. Diabetes is, type 1 diabetes is to this day a relentless and often crippling disease. And complications include kidney disease, blindness, some nerve damage, also a condition referred to as hypoglycemia, unawareness, when patients become unconscious as a result of insulin reactions. So type 1 diabetes has remained a significant problem. We have wonderful new treatments. We have new educational programs. We have new diabetes technologies. We have new insulins, but nevertheless, patients remain compromised, and these new treatments, while they work for some people with type 1 diabetes, they don't work for all people with type 1 diabetes. So therefore we need to be concerned about those who are not very well served by those new treatments, and develop even better treatments for this subgroup of people affected and burdened by type 1 diabetes.
What is islet cell transplantation?
Islet cell transplantation is an emerging new treatment for people with diabetes. Islets are clusters of insulin-producing cells located in the pancreas. In people with type 1 diabetes, all islet cells are destroyed by the autoimmune process leading to type 1 diabetes. We have now shown several groups around the world that islet cells can be isolated and retrieved from a donor pancreas and can be infused into the portal vein, where they get carried with the blood to smaller and smaller branches of the portal vein. They lodge and become reconnected to a blood supply. And when successful, patients will have restored tight control of their blood sugar levels, and a very large proportion of patients will become insulin independent after transplantation. So when I say when successful, I know currently the success rate at experience centers is around 90%, at least short term. And now the long-term success is also improving. We have 50% of patients who remain insulin independent for more than 5 years. Some of our patients are insulin free now for more than 15 years after a single infusion of islets. And patients experience a transformation in their lives. They feel confident. They are now able to live a productive life again. They don't need to worry about diabetes every minute of every day. They don't need to worry how they can get through the day. They can make plans how they can really develop a career or support their families. And it is really this transformational experience of our patients that has inspired us to develop islet transplantation into a more widely available treatment option for more patients with type 1 diabetes.
What are the benefits and what are the drawbacks of islet cell transplantation compared to whole pancreas transplantation?
Islet transplantation is a very safe procedure, but is less successful in restoring full insulin independence in transplant recipients. Pancreas transplantation is a very major surgical procedure, often associated with surgical and infectious complications. Islet cell transplantation is a very safe, minimally invasive procedure, but both procedures are limited by the requirement for immunosuppressive medications necessary to prevent rejection of transplanted organs. This is the main risk and the main concern associated with transplantation. Another significant benefit of islet cell transplantation is that more widely available cell sources, such as cells from porcine donors or stem cell-derived islet cells, could be considered for transplantation. They're actually being actively developed for use in transplantation. Those options are not available. There's no stem cell-derived pancreas that can be transplanted, or there's no pancreas xenotransplant that any one group is actively pursuing. So I think when it comes to implementing a therapy that is available for tens of thousands of people with diabetes, cell transplantation is the only way to go forward.
What is xenotransplantation? How important is it and how safe is it?
Xenotransplantation is transplantation across species barriers, so such as transplantation from a porcine donor to a human recipient. Xenotransplantation is considered very challenging from an immunological perspective, because the immune response to a xeno donor is considered much stronger than to an allo donor, a human donor for a human recipient. Well, but xenotransplantation also presents a number of opportunities, and that has been my passion for several years. And as we study xenotransplantation, we understand it better, and we come up with very innovative and very effective strategies for overcoming rejection of xeno islets, such as islets from porcine donors. So in xenotransplantation, we can use young donors, completely healthy donors. We can use donors on an unlimited basis. We can time transplantation perfectly well, because donors are available on demand. We can use very, very safe donors, donors that are raised in biosecure facilities, and donor animals are tested and confirmed to be virus-free. And this presents a number of opportunities. And so I think our experts in infectious diseases and in virology tell us that it should actually be safer using organs and islets from medical grade pathogen-free porcine donors than using organs from human donors. Because in the middle of the night, when organs are retrieved from a human donor, or when they are transplanted within a short period of time, not everything is always known about the donor and the risk of disease transmission. And in xenotransplantation, there is time really to prepare for the transplant, and it presents an opportunity also with respect to safety. Now, those are technical or safety differences that are really putting xenotransplantation at an advantage. But there are also other opportunities. It is believed that xeno islets from porcine donors are less susceptible to recurrent autoimmune disease. Autoimmunity caused type 1 diabetes in the first place, and the concern always has been that autoimmunity can persist for decades through autoimmune memory and can cause failure of transplanted islets. Porcine islets appear to be less susceptible to recurrent autoimmunity. A second very important point is that we know our donor in xenotransplantation. We can prepare antigen from the donor, and we can administer antigen-specific immunotherapy before transplantation, a week or 2 weeks before transplantation. And we can prepare the recipient to accept the islets more readily and without a strong immune response. But lastly, the most significant difference and the most significant opportunity is the possibility of genetic engineering. We can now very precisely and very effectively change the genes of our porcine donors, and we can develop pigs with stealth islets that cannot be recognized by the immune system, or islets that are advantageous for different reasons. So I think your imagination is really at the limit. The technology is not the limit. And several groups are now working on genetically engineered porcine donors for use in xenotransplantation, including islet xenotransplantation. And it is a very fascinating and novel opportunity.
What is the current situation involving immunosuppression after a beta cell transplant?
Immunosuppression is required for the prevention of rejection. Immunosuppression is associated with risks of kidney dysfunction, kidney injury, risks of infections, and even risks of cancer. Some 80% of patients do well with immunosuppression, but 10 or 20% don't do so well, and immunosuppressive medication needs to be refined and changed and maybe good solutions are not found, or patients, regardless, develop complications associated with immunosuppression. However, immunosuppression is also evolving, and we have now new treatment opportunities that didn't exist years ago. Immunosuppressive medication has become more specific, more selective, and safer. Now we are using biologics such as antibodies for maintenance therapy, and immunosuppression is administered through one injection once a month. So we feel immunosuppression will become much less burdensome and safer and more selective and more specific. So you are suppressing the immune system, and even if you eliminate kidney toxicity and other side effects, you will always compromise the ability of the immune system to fight infections and to protect the recipient from cancer. That risk is very concerning, and that risk really needs to be taken very seriously. For these reasons, transplant scientists have, for the last so many decades, worked very hard to develop what is referred to as tolerance, and that is survival of transplanted organs without the need for maintenance immunosuppression. And while it has been a very significant challenge, progress has been made, and we are very actively involved in testing tolerance protocols, and we have now in preclinical large animal models the first evidence that prolonged islet transplant survival can be achieved on a consistent basis without the use of maintenance immunosuppression.
What is the future of beta cell replacement therapy?
The future of beta cell replacement therapy is bright. There are many opportunities, and I think these times are very exciting. Not so much only for scientists, that is not important, but should be exciting for patients and their families who are burdened by diabetes. I feel there is considerable momentum, and maybe that is caused by the demonstration of diabetes reversal after islet transplantation using islets derived from human donors. We showed proof of concept. We provided compelling evidence that islet transplantation can reverse diabetes and can help patients enjoy a life no longer restricted by constant fears and worries. We have shown we can restore insulin independence. We can achieve blood sugar control way beyond what has been possible with the most sophisticated diabetes technologies. Now, more and more investigators are joining the field, and also corporate sponsors are getting involved in a major way. And the momentum that is building is substantial. So we see now really significant efforts being made in the field of stem cell derived beta cells. And the technology has improved in the past a few years to the point that now glucose responsive, insulin secreting, very differentiated beta cells can be prepared from human stem cell derived cells. So we have several different cell sources, but then also related technologies are improving. We have many more bioengineers that are joining the field and help us develop novel cell delivery technologies and cell implantation technologies. We have immunologists that really help make immunosuppression unnecessary. With novel cell sources, we don't know at this point in time which cell source will be the best and might not be the best for every single recipient. With new opportunities in cell sources, we still need to develop a very effective and safe cell delivery technology. And I feel very good about very gifted bioengineers joining the field of cell therapy for diabetes and help us develop novel cell implantation technologies or bioscaffolds that can not only help protect islets from the immediate injury after implantation, but can also be engineered to deliver in a very regulated manner molecules that will inhibit the immune system of the recipient. So I think it is a really exciting time, and I think we must take advantage. We must engage new scientists. We must remove all the barriers that still exist, but we must capitalize on the real opportunities that now exist to make beta cell replacement routine and commonplace for patients with diabetes.